Receiving the diagnosis of breast cancer is a little different from receiving another type of diagnosis from a woman's doctor because it comes with a whole journey that's sort of predetermined for her. She's heard stories from her friends, she's read things from books or magazines, she's seen things on television. But in a lot of cases when the breast cancer is caught at an early stage, we are able to cure it. And I'm proud to say that in 5 years, 95% of early stage breast cancer is still cured. I think it's very gratifying to hear women say that they felt comfortable throughout their treatment course because getting diagnosed with breast cancer is a very scary thing. They have to meet a whole bunch of physicians. They get to know them in a very intimate way, emotionally, psychologically, and physically because this other physician is examining them, asking them lots of questions about their treatment course. And there are certain difficult things about chemotherapy, about hormonal therapy, about surgery and radiation that alters a woman's body and her perception of herself. We've made a significant positive impact on the women in this community, and I hope that we can further advance the progress our program has made. On behalf of the Riverside Medical Center cancer team and the multidisciplinary group of physicians and nurses that are involved in the care of all breast cancer patients, I would like to extend my heartfelt gratitude and thanks for being able to acquire a very important part of our diagnostic imaging, which would be the MRI breast coils, because this would allow us to go ahead and move forward with the technology that is available at other very advanced academic centers. And in our community, I think that's a very important thing to provide to our patients.
I'm a preschool teacher at Trinity's Little Lambs in Herscher, Illinois, and I teach the 3-year-olds on Tuesdays and Thursdays, and they are a blast. I've always loved children, and teaching preschool is something that I enjoy.
I like Mrs. Rink a lot. I like Miss Rink.
My husband and my father, and also my mother-in-law, play in a country and western band called Silver Wings. It's a great deal of fun to go out and listen to the band and dance and have a good time. I found a lump in my breast about 4 months after I stopped nursing my youngest child. I didn't really think anything about it because I just figured it was a clogged milk duct or maybe it was a cyst. I had the lumpectomy and Dr. Lang came to my side in the recovery room and he said, "I'm sorry, it's cancer." The recovery room nurse, Joanne, was wonderful. She held my hand, she wiped my tears, and she told me, she said, "You are gonna be okay." She said, "I know you're gonna be okay." My family was totally devastated. I was 33 years old and nobody thought that it would have been breast cancer. I thought a lot about what would happen to my children if I was not around. My children were so young. The oldest one, I think it bothered him a lot. When he went to bed at night one night, he said, "Mom," he said, "why does it have to be you? Why do you have to have cancer?" I couldn't imagine what it would be like for them to grow up not knowing their mother. And I just knew that I wanted to fight and I wanted to do what I had to do to be around to see my children graduate from high school and move on with their lives. I'm an only child and we live next door to my parents and we have a very close relationship. I've always been a daddy's little girl, and when my father found out that it was cancer, he sort of went into a shell and didn't really talk to anybody for a few days. And when he came into the room after I woke up from my surgery, he walked into the room and his eyes were bloodshot, and he walked up to me and he grabbed my hand and he said, "I don't know what I'm gonna do if I lose you." And I said, "I'm gonna be fine." I said, "I will be fine." It's so overwhelming when doctors are telling you, you need to see an oncologist, you need to see a radiation doctor, you need to talk about reconstruction, chemotherapy, radiation. All of these words are very scary. I had the mastectomy and chemo started that next month. I think the hardest thing for me was losing my hair. I've always loved long hair. I've always loved to do my hair, and the hardest thing for me was losing it. All of the chemo sessions were done at Riverside Medical Center, and all of the nurses in Dr. Sapahi's office were wonderful. They remembered my children's names, they remembered things about me, and they were very helpful in every way. I would love to be there for every woman who was ever diagnosed with breast cancer. It was one of the most devastating things, and I think listening to someone's story about what they've been through and knowing that they can do it really helps you think about the fact that you can do it too. I think this experience has changed me in a lot of ways. I look at things differently now. Even the sun, the rain, even when my children misbehave, everything is different to me now. Everything means more. You take things one day at a time, and you learn to worry less about things that really don't matter, when all that matters is that I'm here, that I have healthy children, I have a husband who cares and who's been there for me. So that really makes a huge difference. I will never forget what I've been through. I have all the scars to prove what I've been through, and every time I look in the mirror, I see them. But I know that what I've been through has made me who I am today.